All right. Hi, my name is Julie, and I'm excited about our next episode of Take One Patient. I'm here with Louis Stout, who is working with Providence Hospital System and is a retired Army officer. And I think one of the really cool things that I have learned about his experience and in our conversation is how diverse his perspective is with other communities, with other cultures. And really brings a lot of insight of how the military sometimes faces the challenges that marketed hospitals do and how they perceive these things different. So I'm very excited to have him on our episode today. Louis, if you want to kind of briefly introduce yourself, and then we'll kind of just dive in a little bit on kind of this insight that you have.
Yeah, Julie, thanks. I appreciate it. Yeah, I was in the military. I was in the Army for 30 years and retired last year. Now work for Providence Healthcare System. As I was going through college, I was offered a scholarship, which I thought would be a good way to pay for school. And I thought, hey, okay, sure, that's something I'll try for a couple of years. I can do that. And I thought, oh, then I'll go get a real job. And so my contract was for 4 years, and 4 became 10, and 10 became 20, and next thing I knew it was 30 years, which is mandatory retirement for the military. And it was an amazing opportunity, and just so many different things that I had the opportunity to do, and just a great experience to really build on and build a network and see healthcare from a lot of different perspectives.
Yeah. And that's, I think, one of the things that was very unique about our conversations and unique about you was really seeing kind of a lot of these different perspectives. If you were going to kind of start by first of all, I mean, you're forced to retire after 30 years, but I remember you saying, I felt like I had still so much to give, and that's when you went more into the private sector or public sector, I guess you'd say. What's some of the things that right off the bat that you saw that from your experience in the military that you could bring to the hospital systems that you're working with now?
I think what was most intriguing to me is really to experience, nursing from a lot of different areas, different countries, and how they viewed it. There's a lot of areas in the world where nurse is not really something that they have, as we would define it. There's a military agreement, amongst some of the countries, Australia, Britain, Canada, the U.S., New Zealand, where we define nurse in the same way. And in the military, then we can exchange nurses, doctors, because we've agreed that we have the same standard, same definition of it. But so it was really interesting to be in areas of the Middle East and Egypt and South Africa and working with them and just see how they approached nursing. Some is very similar, and then in a lot of areas, they don't have what we would look at as a nurse. They have doctors, and then they have people that work in the hospital, and the family is used a lot as as kind of that nursing role. In some areas, they actually have to find their own medical supplies and bring them, or do some of the procedures themselves, which is obviously very interesting and very different from our Western approach to nursing. As we've looked at it from Florence Nightingale through the present, and our approach to healthcare from a nursing perspective, it's just can still be very different in areas of the world.
And that's interesting that you had kind of mentioned. I had never thought about that. Is that role that we've defined isn't there? So how did you find that really changed the communication style of some of those providers to family members who weren't necessarily updating them, but sometimes really educating them about what they needed to do? I mean, did it become more of a teacher mindset as much as a doctor's mindset, or how would people know where to go to kind of help support their family member?
A lot of it is, I think it's probably more of a perspective that we had, in the U.S. looking back, 100 years. It was more the family was was more directly involved. You had the hometown physician, and if you look back to before the U.S. had nursing schools, nursing programs, before that was really established as an area of healthcare. It was more that just traditional of working directly with the family. And when the patient was discharged, they went home, and that's who continued the care. I think we just have a different healthcare system in Western culture that's some pros, and there's probably some downsides to it as well. There's just probably less of an approach of healthcare at home, which is now becoming more of a current trend. At Providence, we've started a program of hospital at home, and I know there's a lot of different healthcare systems that have similar ones. Some are more developed, where healthcare can actually be delivered at home, and a step beyond just the home nurse, coming in for a home visit, where now it's becoming more robust in the clinical care that is provided in the home setting, and certainly there's some very interesting perspectives of that, some opportunities there. So we'll have to see how it develops.
Yeah. Well, it's interesting too, because one of the pieces, even in our technology for medical memory that we're building out, is a family share app, where it makes it a lot easier for patients to download the videos onto their phone, with the focus of, I want to be able to share this information with my family, because a lot of the times they're the ones that are starting to take care of me, or going to help me heal, or help me, kind of get back to square one. And so it's interesting, like, we've come a little full circle of, although we have these pieces, is a lot of family members and patients are craving that information of, well, I want to be a part of it, and I want to help, and I want to make sure everything's, good too. That is kind of necessitating the need for easier access to that information to be given, to family members. So it's an interesting kind of perspective. What other things did you find kind of some in your travel, the way that different cultures even perceived their role as a physician, or how they went about, healing, if you will? And the reason I'm leading you, really, what is one of the things I remember you mentioning was one of the communities that you were in, how they really had more of a perspective of sitting back and watching versus kind of diving right in, where Western medicine really does, or some of those things that you started to see, just their perspective on how they approached that was different.
Yeah, I think one of the stories that I shared with you was having I taught for a little while trauma nursing in South Africa, and they gave us some opportunities to go to some of the local facilities, and it was interesting to see private hospital versus a public hospital, and just happen to be in that country. I saw the same thing when I was in Greece and working with the NATO countries that were there. They have a different, healthcare structure or different approaches to the delivery of healthcare. And one of the things that I observed in the public facility, and this one, like I said, happened to be in South Africa, was, they had over 40 traumas per day, true traumas that were brought in. It was a large facility, over 1,000-bed hospital. And they said, "Oh, we have one coming in now. Do you want to observe?" And I said, "Oh yeah, absolutely. I really want to see their approach to it." And what I realized later, after I kind of reflected on it, watching them, it was almost silent. The team approached the bed. They all knew their roles. It was a small team, and they knew what each of their roles were, and they didn't see the need to verbalize it as they were doing it, or really be loud or demonstrative, which as I got back to the US and started working with other teams, it struck me as how robust it can be at times, and in some ways disruptive. In this case, where the trauma provider was assessing the patient, they were doing their head to toe assessment, and they were talking it and speaking it, and the transcriber, who was some distance away, was able to just listen and hear exactly what the provider was saying, and take all the notes down. And then at that time, another trauma came in, and the other team approached, and they were a few bays down and doing their assessment. And they were also just having a quiet conversation and assessing the trauma patient. And they were just, as having been in the military and worked with different groups in the military, there's groups that we refer to as, the quiet professionals, where, they go about their job, they know what needs to be done, and there's not really a need to display it or talk about it. It's just they know their roles. And it reminded me of when I was, riding on an ambulance years ago when I was in nursing school, and that team that I happened to ride with all the time, they did the exact same thing. They, at the beginning of each shift, they said, okay, if we get the big one, here's the roles. Okay, you're going to do this, you're going to do that. And if any time, somebody is doing what is your job, you just, there was a word, it was actually really funny. I'll never forget it. It was quite some time ago, but they had a word, they said it was munyon. And I was like, okay, what is that? Like, it's absolutely nothing. It means nothing. But if anybody is ever doing what you see as your job, you say that, and we all know what it means, and we know to readjust and get back in our role. It was a great approach to it. Everybody knew what their role would be, even though you had either 2 medics or 3 medics. It didn't matter. You knew what your job was going to be if you went into that trauma scenario, which is not the time to try to be figuring it out.
Yeah. And that's interesting, is really taking the opportunity to know that the few words that are spoken, or the person that's speaking at the time, is with intention and purpose, and feeling a lot of trust that, okay, that's where that falls, and this is where I fall. And that's a unique perspective. Do you feel like, kind of as far as like, is that consistent and in more of a military approach versus, in your experience, kind of being, chief nursing officer in the Army before kind of going into a private sector? What are other things that you see are really kind of different between the military and that?
I've really realized that, healthcare is essentially the same no matter where you are. Healthcare is healthcare. It's universal. Illness is the same. Trauma is all very similar. It really doesn't matter, gender, race, whatever country that you live in. Disease. As we see with the pandemic, in this particular case, COVID-19, unlike other recent viruses, from the past 15, 20 years that have, kind of stayed in one area. This one has been able to go everywhere around the world, from, hot areas to cold areas, and regardless of gender or religion or whatever you want to look at, it's been had an equal effect on everyone. And so to include the military, for the past couple of years of the pandemic, I was in a military hospital, and it had nothing to do with the base we were on, or we were federal, and they were a civilian organization. It was the same no matter what, and we really had to have the same approach.
Right. Well, and that was is kind of my perspective, and I don't know much about much, but is kind of more of like the structure that sometimes happens kind of consistently across the board, versus more when you're seeing kind of like innovative hospitals or teaching hospitals, versus more of that standardization or structure. My perception, I mean, I don't, no, but would be that maybe the way that kind of you go about solving some of the challenges that are being addressed might be a little bit different? Or is that kind of the false misconception of most, civilians that have never really been in that world?
Definitely in the military, I think we spend a lot more time preparing for, disaster management, disaster response, mass casualty situations.
Yeah.
We spend a lot more of our time training for that, because those are the environments that we go into, and where it could occur, and has occurred much more frequently in those areas. So I think our approach from that perspective can be different, and we are more likely to put a lot more people towards a situation in the military. And it's just, it's been my impression of it, as far as being in a remote area. I spent a lot of time doing burn care, and the Department of Defense has one burn center, which is in San Antonio. And looking back through their history, I was actually amazed to find out that in the 1980s, they sent a burn team to Russia because there was a large disaster that happened. It actually happened to be a train accident that occurred, with a propane train, tank exploded, and a lot of burn casualties. And the military actually sent an entire burn team there into, in the peak of the Cold War, into Ufa, Russia, as a response. And so, we prepare to not only practice our crafts, in a fixed facility, but then anywhere that we need to take it.
That's probably where that communication becomes key, is because you're not in your space. Like, that's your comfort space. You're not in the same operating room where you have all your stuff. You have to rely more on, well, how do we manage the chaos,
Yeah, when the burn flight team, I spent years doing transports back and forth, transoceanic long distance transports, and I did, that was one of the things that I reflected on. I said, now I know what I know. When you're in the back of an aircraft somewhere over the Atlantic and it's you and your team, it's either you have it or you don't. So if you didn't bring it, you better figure it out. And what I realized was the best piece of equipment was, between your ears. And if you brought that with you, then that's where it has to start. So whatever equipment's in the box, that's good that you have it, but it starts with, your training, and the team that you have with you. That's really the most important part of it. And being where you practice your craft, it can be somewhat irrelevant at times.
That's really interesting. That's really interesting in the perspective of I never really thought that you're kind of you're relying really on what you have with you and the team that's around you. And I think that's where that communication element, or that team communication element, becomes so much more thoughtful, because you don't have the luxury of excess, you know what I mean? Extra space or things or time or equipment, or, you have to kind of be focused on what you're doing, especially in a trauma type situation.
Yeah.
Now, do you miss that part of you? Like, do you miss kind of the time you spent over there, or like time you spent doing that, now that you are in one local place? Or are you kind of leaning more into taking kind of some of that experience into what you're doing now?
Do I miss it? Yes. I enjoyed obviously doing it for years, but it builds up over time, and after, years of doing, back-to-back deployments and missions and even teaching, I was teaching, all around the United States. And then, we went to other countries as well, which was fantastic, but you can only do that, for so long as well. So there's some positivity to be in one place, for myself, for my family. There's some goodness to that, but and also being able to share those experiences, not necessarily to sit and tell stories, hey, there I was, but it's to have a different perspective. So as a discussion comes up, you say, well, here's something to consider. And you just, kind of a different thought process, or a different approach towards it, might give you a different solution that you would not necessarily have considered. And I'm certainly, I learned from all those that I work with as well, of, things that work, or more importantly, things that don't work. And they're like, okay, here we tried that, 5 years ago, it was not successful. Let's not go down that path again.
Right.
good to know. Got it. Let's move on. Take that one off the table. Let's see, what might be, successful.
Right. No, absolutely. And really, I mean, definitely leaning and learning on that, on a different perspective of how it's approached and all of that. Absolutely. Well, that's, and so that being said, is what do you find are kind of, some of the things that when you are giving a different perspective or wanting to think about it different, or even giving advice to people that are starting to say, hey, we want to kind of think about this problem different, or how we're going to approach even trauma in their own spaces. What are some of the things that you really leverage or have learned in your experience that would be useful for someone else kind of facing like something overwhelming, of forgetting their tool between their brains, I guess, as you said, or that?
I think there was, I had a lot of opportunities, and certainly going through some of the senior, healthcare executive courses that the military has was really to force you to think. And actually, I had one instructor who, this was, very purposeful. And the approach was, what else? So, the military, I think, for many years always was fighting the last war. So, they looked back and said, okay, here's what we learned going through that experience, and here's how we can avoid that. And that's okay. That's good on one level. And then there's a lot of time spent saying, okay, what's going on? So looking at what's currently going on. But I had some really good coursework where they said, okay, well, what else is happening? Well, what do you mean? So let's talk about, we got it. We know what has happened. We know what's currently going on. Everybody's looking at that. Everybody's engaged in it. But what else is going on that might be the next thing? Yeah. And that really helped, frame the mindset of being more of a thoughtful thinker for other considerations. And I found that has really helped when looking for solutions. You're like, okay, that's good. We have what we have. Yeah. We have what has worked or what hasn't worked, and then what else can we consider? And so there's been a few things just recently in my new role. I can say, okay, well, got it, but what else? Who else could we bring to the team that might give us the support that could offer a little bit better solution or make us more efficient? Yeah. And it's not limited to being a nurse and looking at your nursing assets. That's obviously one thing, but it's your external support and the ancillary services that help relieve the pressure for the nurses to function at their highest scope of their practice. Right. So when you don't have your ancillary support, when you don't have the other areas covered as also, then that means that your nurses are doing their job and as well as other jobs as well. So as a healthcare executive, a lot of times what I've spent a lot of time doing is saying, okay, I got it. We need nurses always. We're always looking for more, but maybe we need to put more of our organizational resources into another area that would actually relieve a lot of the pressure that the nurses have also taken on, a lot of the additional duties that they've taken on, so that they can focus on their craft. And then and those people also can focus on their craft because I used to talk to a lot of my counterparts in the military, and they're like, well, we need to reduce the healthcare numbers, so we're just gonna cut the numbers. I said, well, could you drive a tank with only half of a tank crew? And like, no, you could never do that. I said, exactly. Well, so you can't just put one person or two people in a tank and say, go. It takes an entire tank crew, and they have an entire process that they need to go through to be certified. And they understand that. So when you say that to them, it's like an OR team. I can't go in there with just a surgeon and just an anesthesiologist. That's great, but that's only part of the team. If I don't have the nurses, if I don't have the circulators, if I don't have housekeeping, if I don't have everyone else that's part of that team, then one, we're not going to be efficient, and two, we probably can't do the surgical case if we don't have a complete team. So our hospital teams are very diverse, and it takes everyone to be part of that process.
Yeah. Well, I love even what you just said that like there, and it kind of goes back to your experience when you were saying, hey, like the nurse has really been defined here. But a lot of times is you are relying on family or people outside of that. But even when you were just saying, okay, for this surgery to be successful, everyone's mind, I was like, okay, the doctor and the anesthesiologist, but no, it's also the, housekeeping and every piece that's a part of like that whole part that's making this whole thing, run efficiently. And I've never really heard someone kind of allude to that the whole piece and not only just that medical part of it. Because even with some of the nurses we work with, they love the patient care of it. Sometimes it's more the administrative tasks that start to really wear on them. So the solution always isn't let's get more. It, as you said, let's take a step back. What else? How can we just look at this different? It's interesting. It's very that's very interesting. A lot of experience there. So great. Well, that being said, is there anything else? I've stolen your time for 25 minutes. You are so intelligent and have so much experience in this space. I could learn from your stories, as I'm sure most of your team and network really like. But is there anything else you kind of want to add that you think might be useful for anyone really starting to kind of take this perspective of yours and how they're addressing patient communication and their own teams?
I think I'm smart enough to know that have been blessed to work with very smart people, through the years. And a lot of what I've been able to share, they're like, "Oh, where'd you come up with that?" I'm like, I didn't come up with it. I work with very smart people who've had some brilliant solutions. And I've had the opportunity to see a lot of what works, and be able to just be smart enough to pass that on, and share that with others. And it makes a difference. And we know, staff satisfaction is directly tied to patient satisfaction. So, being a healthcare executive, the role is to look at resources and say, okay, what else can I do to bring resources to you so that you can be more efficient at your job? And that we can all strive for the best patient outcomes, because that's ultimately is our goal. And that's not always easy to find those resources or to find those solutions, but we keep looking. And in the military, what we say is you're always trying to improve your foxhole. So wherever you are, wherever you're dug in, then you're always just trying to make it better. Whatever that is, you keep working on it. There's sometimes it feels there's never an end to it, but that's good, because you always want to be growing in your craft and growing in your practice.
Absolutely. Awesome. Well, thank you so much for your time today, and for your service and everything that you've kind of done there. And I just thanks again for having us.
All right. Thank you.
Thank you.